All right, good morning everyone. Good morning Queensland, and good morning to all of our Facebook Live followers. First of all, can I report today that we have 9,974 new cases, including 3,960 positive rats. We have, tragically, it's my sad duty to report that we have 18 deaths to report of people who've lost their lives. 12 of these were in aged care, but I'll get the Chief Health Officer to go through them, but the young person in their 30s was not vaccinated. Can I once again pass on my condolences to the families? This is not an easy task, having to report these deaths, and it's unfortunately part of this global pandemic that we are in. In fact, today is 2 years since our first case here in Queensland. So it just goes to show people of Queensland that this has been going now for 2 years, and it doesn't make it any easier every day coming here to report these tragedies. Now, in some good news, the numbers in our hospital seem to be coming down, so 818 today. In ICU, slightly up, 54. The Chief Health Officer will go into more details about that. 19,000 tests in the last 24 hours. We now have 91.9% of Queenslanders have at least one dose, 89.33% fully vaccinated. So it's slowly creeping up to get to that 90% double vaccination rate. Good news, more than 1.3 million Queenslanders have received their boosters, and 30% of our 5 to 11-year-olds have had their first dose. So can I once again please urge parents out there, with school going back on the 7th of February, please think about booking your child in to go and get vaccinated. And to that end, the Health Minister will give more information today about we're opening up a number of schools for a back-to-school blitz. We've identified some areas where we'd like to see more increase of vaccination. So we've gone through and identified more than 50 schools, so they'll be published on our Facebook site and of course disseminated out through the media. But they include places like Arundel State School, Upper Coomera, Gavin, North Lakes, Narangba Valley State High School, Waterford State School, Flagstone, Palmview, Gympie, Springfield Central State School, just to name a few. But it does mean that over the weekend you can pop into these local schools and also get vaccinated. So we're really keen to get as many of our 5 to 11-year-olds vaccinated before school goes back. So please also check the Queensland Health website for more information. Now, today I'm releasing also some modelling that was presented to Cabinet on Monday about our what we were expecting and where we are placed at the moment. Now, we're not out of the woods yet. We've got a long way to go because, as you've heard from the Chief Health Officer, we believe that the Gold Coast has peaked, coming down from that peak. We do expect the peak in the Brisbane southeast region here to be basically starting around now and going for the next week or so, and then of course some of the regions will follow. But I want to share with Queenslanders what we were expecting, and you know, when you actually think about this, you can understand why we've had a lot of sleepless nights. But we were initially expecting, in the worst case scenario, 5,000 beds across Queensland would be needed. Our most likely scenario was around 3,000, over 3,000. And as you know, what we're reporting at the moment is under 1,000. This is encouraging news, but honestly, I have to tell you that we were planning for the worst case scenario, and it was quite frightening at the time. And in ICU, our worst case scenario, we were looking at around 500 beds that were needed for ICU. And at the moment, of course, that's tracking just above 50. And it's actually lower than our low scenarios in both situations. So I think Queenslanders can appreciate that a lot of planning went into this. The modelling is going to be updated as well, but these are very encouraging signs. And today you'll also hear about from the Health Minister and also from the Police Commissioner that the number of staff that have been furloughed is coming down, which is also good news. It doesn't mean by any means that we're out of the pandemic, but it does mean that hopefully we'll see the return of our supply chains. Of course, it means more police are out there to do their general duties, and of course health staff are back into our hospitals. So we're not out of it yet. It has taken a toll on our workforce, and to all of our men and women out there and the families who have been affected during COVID during this time, I know it has been hard for many people. In the majority of people, it is mild. In some cases, people have been quite sick at home, and in other cases, people have ended up in hospital. And we do appreciate the hard work of all of our frontline workers, our mighty men and women of the health service, the police, emergency services, the people out there doing the testing, the people out there doing the vaccinations. This is a huge effort, and government has absolutely been focused on you and the people of this state to make sure that we can get through this as safely as possible. So look, with those few words, I might just hand over to the Chief Health Officer. Then the Health Minister, the Police Minister will do any questions on COVID first, and I'm happy to answer any other questions after that. Thank you.
Thank you very much, Premier. So sadly, we have 18 deaths to report today. Just to remind you, these are 18 people who have died who have had a recently positive COVID-19 test. So as I've said previously, it's not always clear whether the individuals have actually died directly from COVID or a complication thereof, or where it's unrelated. But for the purposes of transparency, we report anyone who has died who has had a recently positive COVID-19 test. So among the 18 deaths, there was one person aged in their 30s who was unvaccinated, 4 in their 60s, 4 in their 70s, 7 in their 80s, and 2 in their 90s. Of this group of 18, 6 were unvaccinated, 9 had had 2 doses of vaccine, and 3 had received boosters. And our thoughts and sympathies are very much with their family and friends today. So we now have a total of 818 people in hospital being treated for COVID-19, which is slightly down from yesterday when it was 829 yesterday. Of course, Wednesday was a public holiday, and sometimes we do see some aberrations around discharge practices around public holidays. So it'll be interesting to see tomorrow how much cases fall tomorrow, now that we're back to a normal working day. So we sometimes see after a public holiday discharges slow down a bit, but still the numbers were down from the previous day, and they continue to fall. Now, again, it's Gold Coast predominantly. We haven't yet begun to see a clear fall in the rest of Queensland, not yet. Clear falls in metropolitan Brisbane, but I would say that the situation in most of Queensland outside the Gold Coast is very stable, and we're expecting to see falls sometime in the next 7 days. Now, there are 54 patients in intensive care, which is slightly up, in fact, from the 48 on the previous day. We know that both intensive care admissions and deaths will lag behind the number of people admitted to hospital. But generally the situation is stable, certainly falling on the Gold Coast, and we're expecting further falls elsewhere in Queensland sometime in the next 7 days. So today is 2 years since I saw Queensland's first COVID-19 case on the Gold Coast, and never at that time did we expect to see such low numbers of patients in our hospitals or intensive care units as we approached this peak. This is quite extraordinary, and it's of course all due to the vaccinations across Queensland and the work of Queenslanders and healthcare workers delivering those vaccines, and it's absolutely amazing. This is not something we ever expected at the beginning of the pandemic exactly 2 years ago in Queensland. You have the modelling we've just distributed was the modelling from 18 days ago, when we were trying to model the Omicron outbreak based on the information we had from international sources and interstate sources at the time. And you will see again the numbers are lower again than even that we projected just 18 days ago. Again, I believe it's because of the extraordinary vaccination rates across Queensland. The boosters in particular, we realise now, have a critical role in reducing hospitalisations, intensive care admissions and deaths. So we've vaccinated now, we've given boosters to more than 1.3 million Queenslanders, and that has played a critical role. I can explain these graphs more later if people are interested. There's some projections there for New South Wales in the orange. You'll see on the graph. So what they are, well, sorry, those are real data for New South Wales. They are offset by 12 days because the New South Wales data is 12. They're 12 days ahead of us in their pandemic wave, and it's also offset for population differences. But you'll see that we're doing better than New South Wales, in fact. So, I mean, everything is looking very good. However, some of this will be due to behaviour changes, I have no doubt, because people are looking after themselves. They are avoiding crowds, particularly the vulnerable. This is definitely not the time to be going out and celebrating. Please do not do that. We know that metropolitan Brisbane and most of the rest of Queensland is either at or approaching its peak. It's certainly better than we expected, but a lot of this will be due immediately due to the natural behaviour changes that have occurred, not because of mandates that we've imposed on Queenslanders, but because of the natural behaviour changes that they have done themselves to protect themselves, which is the right thing to do. So please don't, this is not over, we're at the peak. We'll continue to follow what's happening and keep you advised with these data on a day-to-day basis. So don't go out and celebrate yet, but the news at this stage is good.
Dr. I know we touched on it yesterday, life after COVID. Professor Shen, who was the former Vice President of Taiwan, has come out and made some comments saying that by about June, July, highly vaccinated populations such as Queensland and Australia life will just move on and we should put it behind us. Is that something that you would agree with?
No, I wouldn't be advising that. What will be special about Australia at that time, in the middle of this calendar year, is that we'll be heading into our winter. And in fact, the Southern Hemisphere will be entering its winter after the pandemic wave for the first time. So we won't have the opportunity of seeing what has happened in the Northern Hemisphere in their winter after the Omicron wave. So that will be quite a critical time here in Australia as we head into our winter after the Omicron wave, which the whole world is experiencing simultaneously. The Northern Hemisphere, of course, is experiencing the Omicron wave in their winter. We're experiencing it in the summer. We don't really know what's going to happen as we head into our coming winter. We know that this is predominantly a winter virus, that the cooler environment encourages its transmission. So I would not be taking that attitude at this stage. All the indicators are good. They're much better than we expected, but it's too early to start celebrating yet.
Dr. Gerard, teachers are saying to us that they are very worried about that low vax rate for children. I know that there's the vax blitzes that are happening now. How concerned are you that they're going back to the classroom within a week? As the Health Minister said yesterday, 12 to 15 is still 70% of the young ones, particularly low.
I think I'm not unduly concerned. The children will continue to get vaccinated, and we want them to continue to get vaccinated. We know that the illness in children is usually a mild illness. It's obviously critical that the teachers get vaccinated to protect themselves, particularly with that third dose of the vaccine. So I particularly would like to see the teachers get the 3 doses, and that should protect them.
But there'll be a lot of outbreaks in the school classroom, and that will concern parents and teachers, won't it?
It will cause disruption, I'm sure, because of isolation and quarantine. And there will be rare children who will get a complication, but the majority of children who get this virus will have mild illness. I think it's important, if I can just emphasise this, I think it's important that teachers get the triple dose vaccine. I think it's important that parents get vaccinated, and I think it's also particularly important that the grandparents and other elderly contacts of children get that third dose before children return to school. The children themselves, by and large, the illness is mostly mild. I think the vaccination is, certainly children should be getting vaccinated. I would be getting my child vaccinated, were they that age, and I would certainly be getting them vaccinated, but I think it's, I don't feel the parents should be unduly anxious. The serious complications of COVID-19 in children are rare.
You mentioned we've avoided the worst case scenarios. Do you think, though, the flip side of that is it's fueled a complacency around the booster shot?
I'm sorry,
Has it fueled a complacency around the booster shot then because we've avoided the worst?
That's a good question. I would like to see more people getting boosted. 1.3 million is a lot of Queenslanders, but it would be good to see more Queenslanders getting boosted as schools go back. And that's why it's very hard to get this message right. It's hard to get, I've said this a number of times, it's hard to get the tone right. We are doing way better than we expected, but we don't want complacency either. So we really do want people to get the boosters, particularly the vulnerable, particularly anyone over the age of 40 or 50 should be getting boosted. Yes, so, and obviously those with underlying health conditions. So, but we've got 1.3 million people boosted already, which is not too bad, but I'd like to see more.
I'm sure the Premier will touch on it, but would your advice be to the Premier down the track that the term fully vaccinated would mean the booster? That again would then not force Queenslanders, but it would certainly encourage them a lot further to come forward.
I think the definitions of what is fully vaccinated should be something determined at national level by the National Cabinet with the advice of AHPPC, ATAGI, etc. I think it's not. I don't believe it's appropriate for us to be making that call at state level.
Did you do the same modelling for a predicted number of deaths? And is there a reason that hasn't been released?
We don't have. We didn't. No, there is no reason it hasn't been released. The problem was at the time of that modelling on the 18th, we didn't have good models for deaths. So that's. And I'm not sure that I have seen any good modelling for deaths. There was some very crude modelling which showed huge numbers of deaths, which just didn't seem right. No, there aren't good models for Omicron deaths that I have seen.
Is 18 the highest number we've had in any 24 hours?
I think it could be. I think it could be.
Yeah.
Thank you.
Thank you. And sadly, yes, 18 is the highest daily death rate that we have seen so far. And I also want to pass on my condolences to the families of those who have passed away and tested positive COVID over the last 24 hours. I also want to just talk briefly about the fact that we're seeing misinformation out there about the proportion or percentage of people unvaccinated who are in hospital, in ICU and who are dying. And that when we report 18 and we talk about 6 being unvaccinated, there is this mistruth out there that somehow that is evidence that vaccines don't work. This is the figure people need to understand. The unvaccinated population only makes up about 8% of all eligible Queenslanders. But currently, they're making up between 20 and 30% of our deaths. That's the rate. 8% of the population, but 20 to 30%, including the last 24 hours, 30% of these deaths are unvaccinated people. When Dr. Gerard and I visited Redcliffe Hospital yesterday and spoke to the ICU staff, they'd had 4 people in ICU this week. 3 of those people are unvaccinated. And people need to look at the proportion. Obviously, with almost 92% of the population having at least 1 dose, proportionally there'll still be plenty of people who are vaccinated who will end up in hospital and ICU. But it is the fact that we are seeing a higher rate if you're unvaccinated compared to the rest of the general population. And this reinforces that vaccinations are so important. And whether we're 5 to 11-year-olds, 12 to 15-year-olds or 16 plus, coming out and getting your first, your second and your booster is absolutely critical. As the Premier said, we've already started with some today, but over this weekend and for the following week, including next weekend, we'll have a school Vax Blitz again, and so we'll have up to 55 schools so far participating over that week. A number of those schools are coming online and available this weekend. Please check out our website or the social media and Facebook as to which schools are open, the hours are open and the days, but we'll have certainly a number of schools that are opening during the week as well next week, just to create more availability. So all of our existing sites will still be available. These are sites on top of that at the local schools for the local families to come and get their children vaccinated before school goes back. I also want to talk about just the positive signs we're seeing around staff being unavailable across the health sector because of COVID. Back on the 18th of January, we were reporting 6,048 health workers who are either positive and isolating or close contacts having to quarantine. I'm really pleased to say, as of today, it's 3,963, and we've been seeing it sort of sitting around that 4,000 mark for about 4 or 5 days now, and that's a 2,000 reduction of health workers now able to be back in the workplace. And I know police have got some really positive results as well. We're hoping that this is starting to be reflected in the broader community, with more staff being able to go to work, whether it's distribution centres, abattoirs, our supermarkets, and hopefully seeing more food getting onto our shelves and more freight and stock moving around the state easily. But as Dr Gerard said, we can't get ahead of ourselves. We haven't hit the peak yet, and we are starting to see some ICU increases elsewhere in the state. We can expect that as cases start plateauing. We still will see hospitalisation and ICU climb for a few days after that. So please keep following all the rules: mask wearing, social distancing, good hand hygiene, and if you have symptoms and if you are not able to access a rapid antigen test, you can come forward and get a PCR test at our clinics, and some of our clinics are still providing those RAT tests for certain groups as well. So we do want people to realise that our testing clinics are still open. Check the site as to the availability, but you can come in, you can walk in for a test, and of course our vaccination clinics, you can do walk-ins as well. People don't need to worry about a booking, you can walk in and get a vaccination.
Minister, how detrimental was, to the plan moving forward, was the decision for Queensland Health to withdraw that document, which was going to allow asymptomatic COVID-positive health workers to come back? When you hit that Tier 4, Tier 5, is that going to be very difficult for that plan moving forward?
No, not at all. We had not needed to initiate that protocol of having asymptomatic positive staff come into the workplace. Hasn't been utilised at all as yet. And certainly the way our modelling is tracking and what we're seeing in real cases in our hospitals right now, it would be unlikely that we will need to exercise that. We are certainly staying on track of staying in that level 4 range with most of our hospitals, and I'm really pleased with that. Early days, but very, very pleased to see what we're sitting at that level 4, which means we only have around 300, so today it's 386 close contacts. So 386 out of, 398 today out of 1,902 that we're calling back. So we aren't even calling all of our close contacts back, so we are a long way away from needing to call any positive staff, and hopefully we never will.
Thank you. Thanks.
Good morning, everyone. So, as you've heard, it is 2 years ago today that we started this response. We sat around the disaster management table hoping that the response was going to be a year, and obviously that has turned into 2 years and now beyond. During that period, at the height of it for the QPS, we had some 1,200, 1,300 police dedicated to COVID duties, quarantine, hotels, borders, and in recent months they got down to about 500, and when we made the announcement that when we hit 90% those members would come back, that interestingly coincided with the rise in the Omicron numbers. So as a result, and very similar to what the Minister has just said, at the peak of it on the 13th of January we had some 1,052 police and staff either positive or in isolation or in quarantine as a result of COVID. That was mostly police in those numbers, and today that number is down to 580. So very much in line with the modelling, as you've seen today, but also what's happening in terms of health. This for us is extraordinarily important, as you can appreciate, because it just allows police to get back to BAU, and particularly the areas more so around proactivity and prevention and not just responding. So once again, good news, aligned with the modelling, and certainly seeing those numbers come down as well. Thank you.
Premier, will you, I know that the National Cabinet yesterday, there was obviously talk about the term fully vaccinated, the Indian National Plan. As the Premier of Queensland, we've seen that you've got a very tough stance on people that are unvaccinated. Will you likely stick to a national plan, or do you think, if here in Queensland you'd like to see the term fully vaccinated be people that are boosted?
Yeah, look, we had a general discussion about that, and I think we do need some further advice from AHPP.
Day since you most likely received a phone call from the doctor standing behind you. There were some smiles yesterday from both the Health Minister and Dr Gerardo at where we're placed. How are the feelings of the Premier at the moment?
At the moment, I mean, you only have to have a look at that paper that we handed around, that modelling. I am relieved. I'm absolutely relieved. We're not out of it yet, and like we know, we're going into the peak, so I still have that message to the vulnerable members of our community to seriously think about, don't mix with crowds, especially over the next couple of weeks in the southeast. But we were planning that worst case scenario, and it is absolutely heartening at this stage that the modelling to date is below even the lowest scenario. So can I say, I did actually mention to National Cabinet yesterday in terms of Queensland's position in terms that the hospitalisations were coming down. But having said that, we haven't been through the peak yet. That peak is basically on us now in the southeast. So I just want everyone to be thinking about their movements. If they're young, boosted, go about your life normally. Keep your mask on, of course, but elderly people the next couple of weeks, just be very cautious.
Did you ever think you would be here today? Like, when you got that phone call, can you explain to us how it was?
We were the first state to actually declare it a public health emergency, the first state in the nation. And, back then, Dr Young advised me that she was seeing some data that was coming out of China. The World Health Organization was making some comments on that, and it was something we had never really thought would happen. I don't think any Queenslander knew what was about to unfold. And clearly too, it's Queenslanders that have really helped deliver this result that we're talking about today, because Queenslanders have got vaccinated. And I thank each and every person for doing that. I know my team were very concerned about some of the low vaccination rates, and we ran a campaign for 6 to 8 weeks. We offered every single Queenslander the opportunity to get vaccinated.
The opposition leader said this morning.
Sorry, we'll just finish COVID first, and we'll move to other things. Everyone's finished? Oh, so I can...
The opposition
Hang on.
leader said
Can I just ask the Chief Health Officer and the Police Commissioner they can leave? Is that all right? No more questions for them?
Premier, does
Yeah,
the
Claire?
Commission of Inquiry need to be held into government interference with the state's integrity bodies?
We have a very robust system here in Queensland. We have the CCC, which is essentially a standing royal commission. Now, the PCCC made some very serious recommendations, and that report will be considered at length by Cabinet. It is a very, very serious report, and I have made a commitment to the people of Queensland that Cabinet will make that decision and they'll go through it very, very thoroughly.
The opposition leader said
Claire?
this morning that you've been hiding behind COVID and that there's a culture of cover-up in the government. What is your response to that?
I think that the opposition leader needs to have a reality check that I hardly saw any of the opposition members out there campaigning to get Queenslanders vaccinated. You only have to look at that modelling to see what we have been absolutely focused on in terms of keeping Queenslanders safe during probably one of the most trying times that this state has ever seen. One at a time, sorry.
The former state archivist has delivered a scathing assessment on integrity and accountability in your government. Are you concerned by that, and will you be launching any sort of review or inquiry into it?
Well, in relation to the state archivist, can I just say this, that my understanding is that he outlined his concerns to the CCC in 2021 prior to his departure. Now, can I also remind, and this is for every public servant, and it's very clear, that in Section 38 of the Crime and Corruption Act 2001, it places an obligation on public officials, and that includes CEOs, to notify the CCC of a complaint or information or matters that involves or may involve corrupt conduct. That is an obligation of every single public servant that works in government, and I expect every public servant to abide by that in terms if they ever suspect or think anything is not going well, to actually refer, and that's the course that should happen.
What he said though, Premier, he seems quite specific and broad at the same time, referring to a culture as someone said.
Yeah, but he also,
as Premier?
well, it concerns me that he outlined these concerns, and apparently they went to the CCC. So,
were you aware at the time that those complaints went to the CCC?
sorry,
Were you aware at the
No.
time that he'd made those complaints?
no, I wasn't.
Did
Has
you
the
work
decision to
with
sack Mike Sumner will come back to bite the government on the backside?
We didn't sack them. He
He says
departed.
he was terminated. He says he was terminated.
Well, that's not my understanding.
He says he was terminated. He says he was told his contract wouldn't be renewed.
That's not my understanding. My understanding was that he was offered an extension.
No, he wasn't offered an extension. And Minister Enoch last year spoke in the House and said that he chose not to renew it and go to New Zealand, but that's not the case.
Well, that's my understanding.
He said he woke up one morning and his contract wasn't renewed, and it took him by surprise.
That's not what I've been advised.
Premier, were you aware that the Integrity Commissioner had sought approval from the Department of Premier and Cabinet for a forensic examination on a laptop after her initial request was denied by the Public Service Commission?
I'm happy to talk about the Integrity Commission now, so let me say this. I respect the Integrity Commissioner of this state, and the Integrity Commissioner is still the Integrity Commissioner until July. I think there's been a bit of misinformation that people think the Integrity Commissioner is finishing today. The Integrity Commissioner is finishing in July. Now, I'm advised by my Director General that certain allegations relating to the laptop, including the manner in which it was obtained, have been referred to the CCC. As these matters are under consideration by the CCC, I'm advised that it will not be appropriate for me to comment further.
Given the nature of what he was saying about his termination, Premier,
Sorry?
given the nature of what Mr Sumner was saying about what he calls his termination, are you concerned that regardless of whether you beg to differ on the circumstances of his departure, that his claims will discourage other whistleblowers to protect?
No, I absolutely encourage, if anyone suspects any form of corruption, they should make a complaint through the Act as the CCC.
He lost his job because he was trying to do his job.
Well, that's not what I'm advised. So I can only go on my advice. Sorry?
looking into his allegation?
You'll have to ask the Triple C that.
I mean, you've said a number of times that it's not
Yes.
what you've been advised on both Mr. Sumner and other matters. Do you have your head in the sand on integrity?
No, I've gone through this and I've asked for information. I'm telling you exactly what I've been advised. Okay?
He says legislation isn't strong enough.
We can't answer 4 questions at once. I'm more than happy to answer your questions one by one.
Okay. He says legislation isn't strong enough that would ensure accountability. Why then shouldn't a review be considered or laws changed?
In relation to what aspect?
The act that he referred to in his letter.
But what aspects of the Act?
That he is to do with the State Archives Act.
But what aspects was he complaining about? Do you have those?
Have you read the story of the letter?
Sorry? Yeah, I have. Yeah, but what were you referring to, Dominic? You're asking questions. I'm happy to answer them.
So you don't think any review at all needs to be considered after what he said in his letter?
My understanding is that Acts get reviewed quite regularly.
But doesn't his concerns and the concerns of the outgoing integrity commissioner warrant a wider...
Well, let me look, and I've got permission from the Integrity Commissioner to read this. So, in her resignation letter, this is what she said. She said, "The demand for my service during my tenure has primarily been due to the government's preparedness to adopt a higher standard of ethics and integrity. It is a credit to you as Premier and that the standard which apply to ministers and assistant ministers are of the highest calibre in terms of ethics and integrity." That's what she said in her letter.
But she also asked for a formal investigation of interference in her office.
Yep, so there's a couple of, let's go through it. There's a couple of issues there. So the first issue is in relation to the laptop, which I said has been referred to the Triple C. I can't comment on that. You'll have to ask the Triple C. No, can I just finish? Sorry, because I just want to get this all on the record so we're clear. So the second issue is that as part of the Act, we do a strategic review of the Integrity Commissioner's Office. That review was done by Kevin Newbury. It was tabled. It was given to the Economics Committee. The Economics Committee is currently receiving comments of that. My understanding is submissions close on the 31st of January. Then it comes back to government for a response. The Integrity Commissioner also provided information to that committee as well. The review examined all structural and operational aspects of the Integrity Commissioner, as well as its relationship with public sector entities, relevant ministers, assistant ministers, and that's been referred to the Parliamentary Committee, which is due process for the review.
Premier, can I just ask you, can you see to the public how it's hypocritical that at the moment there's a lot of reports coming out about the government and its integrity? You've talked about there's going to be investigations, we know that. But then again, there's a Queensland journalist that has been threatened with jail for not giving up sources. Can you see how that's a tad hypocritical? Have you asked anyone, or will the Triple C ask anyone to give up their sources with any of these investigations?
Once again, I'm sorry I can't comment on that case either, as that matter is before a court.
Premier, do you have confidence that the Department of Premier and Cabinet has not interfered with statutory bodies?
Yes, I do have confidence.
Have you spoken to Minister Enoch this morning about the situation with Mark Sumner?
No.
Do you
Well, we know the government's...
today?
Sorry?
Are you going to today?
So am I going to talk to her?
Yeah, that is.
I'm happy to get full information from her, but yeah, about it. Yeah.
Premier, we know the government's first choice as Chief Health Officer, Chris Markovich, reconsidered the proposition of taking the job. Are you familiar with the reasons why he did not take up?
Yes, I am, and they're personal, and I don't want to go into those publicly. They're a matter for him.
Just to clarify
Yep.
one of my questions before, so on Monday, in terms of whether or not you knew the Integrity Commissioner had sought approval from Department of Premier and Cabinet, you said you weren't sure. Today you can't provide anything further on that because it's before the Triple C.
But also in Parliament, I also said that some matters have been referred to the Triple C, and now I can confirm to you that that matter, particularly about the laptop, is with the Triple C.
So you can't say whether or not you knew.
No, I didn't know.
Premier, the opposition also said that this is all an indication of a third-term government which has become arrogant. Is that right?
No.
Are you proud of your government's track record with integrity and
Yeah,
accountability?
yes.
The State Archives said politicians have absolutely no interest in promoting
But just in relation to that, I just go back to Dominic. I mean, we are always looking to do better. Okay, so that is why I am saying that if there are any allegations, people need to raise them with the Triple C. The Triple C is the Standing Royal Commission in Queensland.
Would you support a commission of inquiry, though, Premier?
As I said, that is one of the recommendations that the PCCC has made, and that is one that the Cabinet is going to give very careful consideration to. Sorry?
Would you support
Well,
this?
I'm part of a Cabinet, and the Cabinet will be considering it.
And the PCCC
Yeah.
report
Yeah,
on
it's a very serious, serious recommendation, and I've said very publicly, I am taking it very seriously.
the PCCC recommendation
Yep.
on that commission of inquiry was related to the CCC. Do you think it should be expanded out, given all the things that have happened this week?
But
to look at the integrity.
let's be very clear, the Integrity Commissioner is not leaving until July. It's been painted as if she's finishing up today. She's not.
But do you think that commission of inquiry needs to be expanded, given the comments from the State Archive?
It's very clear the recommendation of the inquiry is coming from the PCCC in relation to the matters that have been raised with the committee.
Will Cabinet consider, though, expanding that inquiry, or is it just considering it as related to the CCC?
There are legislation. There is legislation there for complaints of public servants to be made to the CCC, and that is what was set up as part of a robust standing royal commission in this state of the PCCC. Now, can I just say finally this? I'm not going to be lectured to by the LNP at all. David Crisafulli sat around the Cabinet table and made decisions to the detriment of the public and to the institutions of this democracy in this state that we hold dear. They attacked the judges, they attacked the doctors, they sacked the PCCC committee, they hand-pointed their own chair of the Crime and Corruption Commission, who it was alleged went into the Premier's office back then and they was basically told to write an article in favour of that government. So I will not be lectured also by a government that had the cameras thrown out of question time now, and also increased political donations so the public would not know who was donating. Now, we have put in place robust laws, and I expect a very high standard from my ministers, from my assistant ministers and every single member of my government. That is what I stand for, and the people of Queensland know that. I stood and fought every single day for what that LNP government did to the institutions of our state, where they attacked the CCC and they actually took away staff. Now, we have robust institutions in this state, and we'll uphold those institutions.
I know you have comments from the former State Archive saying politicians have absolutely no interest in promoting transparency and accountability in government. What kind of trust and faith can the public have in your government?
I think the people of Queensland know me. They know I work every single day to uphold their values, to keep them safe and look after their
I would
families.
see him as impartial, though, wouldn't they?
Sorry?
They'd see a former senior public servant as fairly objective, figure and expressing his view.
Oh, I welcome people expressing their views. That is what keeps our democracy alive. That is why members of your fine institution as well ask questions. You should be allowed to ask those questions. And I'm giving you answers to the best of my ability, of what I am being told and what I am being advised. Now, unfortunately, in some instances, I cannot comment any further because some matters are before the CCC. Some matters are before the Parliamentary Committee. We have a robust institution in this state and we will always support them.
In light of what Mike Summerall has said and the issues he's raised, do you think that there is something wrong at the heart of the culture in your government?
No, but any concerns that he is allowed to raise with his Director-General, and he is allowed to put independent complaints into the CCC, of which I'm advised is what he said in his article.
Premier, have you discussed any of these issues with Dave Stewart this week?
No.
Premier, just a question on the refund. Sorry, the Commonwealth.
I don't know why you would ask that question. Anyway.
$1 billion.
Sorry?
Just a question on the
Yes.
the Commonwealth's given $1 billion. Will that be enough to keep up with that?
Look, my understanding is that the $1 billion is over 10 years, so it's out into forward estimates of, you'd have to elect the Morrison government for the next 3 terms to actually implement that. It would have been good to have seen some money up earlier, but look, we welcome any money that goes into the Great Barrier Reef. It's definitely worth protecting.
Okay. Thanks very much.
Thanks, everyone.
Thank you.
Thank you.
Thank you.